very often we come across questions which ask us to differentiate between eumycetoma and actinomycetoma, and often we find that confusing. So one should remember that uh, bacteria are written earlier than fungi in Anand Narayan or Panikar. So what we should remember that actinomycetoma is primitive in evolution, whereas eumycetoma is advanced in evolution. So by remembering this simple fact, we can do a lot of things. Now, actinomycetoma, it is active, and mycetoma represents fungus-like, and it is an active fungus-like bacteria that we should remember this additional information. Rest we can derive from it. Now, since it is active, it will divide rapidly, and fungus like, so it involves the foot, actinomadura and nocardia asteroids, white yellow grains. Moreover, since they are actively multiplying and actively invading, so they invade the bone earlier and extensive, slender and non-septate, because they are early in the evolution. So they would be non-septate, there will not be septation. And since they are earlier in evolution also, so they are pass negative, they cannot pass the exams because they are old. Like old people just cannot learn the modern uh, computers and all. Likewise, old actinomycetoma cannot pass. Moreover, it is gram positive filament, because what primitive bacteria were like that only, they were gram positive. And actinomycetoma are difficult to visualize, but since we have this actinomycetoma, which is a bacteria, so we can have antibiotic that have a good response against it. Now we move towards the eumycetoma. Now in eumycetoma, true fungi. Now what do you expect from true fungi? We expect that it would be septate, and it would be more adapted to the environment. So uh, they are slow dividing. Moreover, they occur everywhere in feet and hand. They have reached everywhere, and they are well circumscribed and marked only in later stages, because in earlier stages body is confused to this highly adaptable organism that what to do against eumycetoma. And now, since it is a fungus, so it will have septate hyphae, periodic shift positive, and again, and it would be gram negative, remaining true to what a fungi should be like. And since they are very well adapted, so we cannot kill them. We have not devised a drug that can kill these fungi, so therefore they are unresponsive to antibiotic, and they require surgical debulking.